Welcome back again to another episode of Medical4dummies. Medical stuff, easily explained. And remember, hit the like button if you want to become smarter than your general practitioner. And most importantly, this is no medical advice. Always check with a doctor or call the emergency services when you're in urgent medical need. Today we are going to explain what a pulmonary embolism is, how you can recognize it and how it can be treated. To start, what is an embolism exactly? A pulmonary embolism, or PE for short, is a potentially fatal medical condition that often remains undiagnosed until it is much too late to treat. It is a condition that occurs when a blood clot, which often begins in the deep veins in the legs or hips and travels through the circulation, becomes lodged in the pulmonary arteries and prevents blood from flowing to the lungs. This is how a pulmonary embolisms occur. It is necessary to have an understanding of what causes pulmonary embolism in order to have an appreciation for the severity of the condition. Blood clots, which may assume a variety of forms, are the most common cause of PE. The most typical cause is a condition known as deep vein thrombosis or DVT. DVT refers to a condition that occurs when a blood clot develops in one or more deep veins, most often in the legs. A pulmonary embolism, PE, may develop if a piece of the clot breaks off and travels to the lungs. But lung embolism may also be caused by other forms of embolism, including the following. Fat embolism. Fat globules from shattered bones or other sites may sometimes make their way into the circulation and obstruct the pulmonary capillaries. This happens very seldom. Air embolism. If air bubbles are able to enter the circulation, they have the potential to obstruct the airways in the lungs. However, this condition does not occur very often. Amniotic fluid embolism. This condition occurs when amniotic fluid enters the mother system after giving birth and causes an allergic response. This reaction may then lead to pulmonary embolism, PE. Risk factors of an embolism. In general, these different risk factors may be classified as belonging to one of the following categories. The risk of developing blood clots is increased when a person is immobile for an extended period of time, such as when they are sleeping or traveling for a long distance. Surgery and hospitalization. Surgery, particularly surgery on the hip, might increase the risk of developing deep vein thrombosis, DVT, and ultimately pulmonary embolism, PE. Changes in hormone levels and an increase in blood volume during pregnancy, combined with the physical stress of giving birth, may all contribute to an increased risk of blood clots. Your family's medical history. If you have a history of blood clots in your family, it may indicate that you have a predisposition to develop these conditions yourself. Cancer. Certain types of cancer and the therapies for cancer might increase the risk of a blood clot developing in the patient. Smoking. Smoking damages blood arteries and increases the risk of blood clots by making it more probable that they will develop. Obesity. Having an excessive amount of fat in the body might make it simpler for the blood to coagulate. Having previously suffered from pulmonary embolism or deep vein thrombosis increases the likelihood that one of these conditions may recur. The symptoms. Some people may only have moderate symptoms, while others may experience far more severe ones. The following are some common symptoms. Sudden shortness of breath and unexpected shortness of breath, which is commonly accompanied by chest discomfort, is one of the most critical indications of pulmonary embolism, PE. Chest pain. The pain that you feel in your chest might be severe, and it will grow much worse when you take deep breaths. It is often referred to as pleuritic, which describes a condition in which the pain is exacerbated by movement or by taking deep breaths. Cough. A persistent hacking cough, which may or may not be accompanied by bloody mucus. Rapid heart rate. People who suffer from PE often have tachycardia, which indicates that their heart beats more quickly than it normally would. Swelling in the legs. Swelling, discomfort, or swelling in one or both legs might be an indication of deep vein thrombosis, which could lead to PE. Deep vein thrombosis is a risk factor for PE. How to diagnose a pulmonary embolism. When detected early and given the appropriate treatment, pulmonary embolism may respond well to medical intervention. In order to address this issue, medical professionals resort to a variety of diagnostic procedures and therapy modalities. Diagnostic procedures include computed tomography lung angiogram, also known as CTPA. This imaging technique is excellent in revealing pulmonary embolisms. In this procedure, a contrast dye is injected into a vein in order to improve visibility of the blood veins found in the lungs. A positive result from a blood test for D-dimer may indicate that you have blood clots if the levels for D-dimer are high. However, since this test is not the only one that can tell, it is often used in conjunction with other procedures. Ultrasound. Imaging with ultrasound may detect deep vein thrombosis in the legs, which can lead to pulmonary embolism, PE. How can an embolism be treated? The first option is medications that prevent the clotting of the blood. Blood thinners such as heparin and warfarin are often used to prevent the formation of further blood clots. These medications have the ability to staunch bleeding and prevent the formation of new clots in the blood. Thrombolytic therapy. In severe instances of PE, it may be necessary to provide clot-busting medications, which are referred to as thrombolytics, in order to swiftly break up the clot. Only in extreme cases, when someone's life is in jeopardy, would this therapy be administered. It carries with it the risk of bleeding. An embolectomy can be necessary if the prescribed medications are ineffective or if the blood clot is really large. A clot is removed from the lung airways in a straight line by a surgeon when this procedure is being performed. Inferior vena cava, IVC, filter. An IVC filter is a device that may be implanted in the bodies of patients who have a high risk of experiencing recurrent pulmonary embolisms. This device is intended to prevent blood clots from traveling to the lungs in the body. Preventive measures against a pulmonary embolism. To a large extent, avoiding pulmonary embolism may be accomplished by lowering risk factors and cultivating healthy routines in one's life. The following are some significant strategies to put a halt to it. Don't sit motionless for too long. This is particularly important while traveling for a long distance or when spending a lot of time in bed. Instead, get up and move about often. Regularly stretching your legs can help get your blood pumping. Make sure to stay hydrated. If you want to prevent your blood from becoming overly thick and sticky, which might make it easier for blood clots to develop, drink a lot of water. Compression stockings. It is possible to prevent developing deep vein thrombosis by wearing graded compression stockings during extended periods of inactivity. Because of the pressure that these socks provide to the legs, circulation is improved. Medications. In some circumstances, such as after major surgery or for persons who have a high risk of developing blood clots, physicians may advise patients to take medications that thin the blood as a preventative measure. In conclusion, an embolism in the pulmonary artery is a condition that is immediately life-threatening and has to be recognized and treated as soon as possible. It is important that both medical professionals and members of the general public have an understanding of the disease's origins, risk factors, symptoms, and treatment options. In a world where having a knowledge of something and being educated about it are both highly essential, the spreading of information about pulmonary embolism may save lives and minimize the impacts of this hidden killer. We are finished with this episode about pulmonary embolisms. Hopefully we made you a little smarter again. Hit the like button and follow us so you don't miss the next episode. Until next time, to Medical for Dummies.